Smooth Health on the Drive.
It's a global observation that helps raise people's awareness.
Insightful tips and information to live in a healthier and happier life.
How to prevent it, detect or treat it.
Smooth Health is powered by Evercare Hospital, Lekki, transforming healthcare in Nigeria.
If you didn't know, now you know.
This is Smooth Health on the Drive.
Okay, welcome, of course, to the Evercare Smooth Health, brought to you by Evercare. And, of course, I do have a special guest in the studio with me. And we're going to be talking about critical care, the evolution and importance in a patient's overall care. And with me, of course, today is a doctor. And we're going to be talking about something very important. We don't talk about this enough, critical care. And joining us on the show, and is ready and equipped to answer all our questions and also give insight on our topic. And yes, we do have Dr. Paul Rony, who is a critical care unit at Evercare. Good afternoon. How are you, sir?
Good afternoon, Jeannie. I'm very good. Thank you for inviting me here.
Okay. All right, then. Now, Dr. Paul is an intensivist with core specialty trainings in critical care and has more than 9 years of experience as an intensive care doctor, both working in organized units as well as setting up new units with processes and protocols. Now, over the years, he has seen numerous surgical and medical cases and has handled a wide range of critical care issues, including varying degrees of sepsis, and is very knowledgeable in managing organ support, bedside procedures, antibiotic selection, and infection control practices. He has successfully managed patients with a wide range of diseases involving neurological, cardiac, respiratory, kidney, liver, endocrine diseases, obstetrics, trauma, and burns. A wide range of toxicological cases, including snake bites, have also been treated by Dr. Paul, and he has wide experience in managing patients with severe ARDS and proficient in advanced ventilatory processes and ECMO as well. He's also adept in ultrasonography in ICU, also part of a team that initiated cadaveric donor transplants and formulated policies for the same in his hospital in India. And he has experience in handling post-transplant patients, including liver and kidney. Wow, so much about Dr. Paul Rony. And he has a special interest in academics and has been involved in several in-house training of hospital personnel as well as medical students, including core clinical training and quality related training as well. He's also certified BLS, ACLS, and ITLS trainer. Is also a regular attendee of many national and international conferences. So many strings to your bow, Dr. Rony. And also part of the organizing committee for the National Conference of Critical Care in India, Critical 2017, and was associate faculty at the renal replacement therapy workshop as well. Besides, he is an active member of the Indian, American, European Societies of Critical Care Medicine and extracorporeal life support organization. In addition, he has a certificate in medicine and law in India. Welcome, Dr. Paul Rony. I'm running out of breath.
Thank you so much. I mean, I know it was extensive. I know you ran short of breath. I ran short of breath here listening to you as well.
So that's why I said so many strings to your bow. I mean, I'm reading, I'm like, oh my, when am I going to stop? You know? But I mean, you must have actually said, when are you going to stop doing all of this?
Yes.
You know?
I mean, it's taking the time of my time to talk to. I mean, because our topic is wide, it's critical care. We have lots to discuss in the short time we have. I think we'll go straight to the questions. Thank you so much for that lovely introduction that you gave.
Yes, it's like almost trying to welcome the Prime Minister. Okay, so let's get to the things at hand right now, right? So what is critical care?
Well, to put it short, critical care is actually complex diseases they come to a hospital, you investigate this disease, diagnose the disease, intervene where you have to, and treat them. That's critical care. It's complexity of every disease. When you read that small string that they've given, I think you mentioned a wide range of diseases. There is cardiac, there is neuro, there is renal, there is pulmonology. So any disease in medicine, you go to the complex aspect of it. I would like to take some cue from your musings as well. There are certain times when the local government person catches you and you know what wrong you have done. That's the easy part of it.
Yeah.
The complex part of it is when...
How do you get out of it?
But before that, you don't know what's happening. You just know that a 20,000 or a 25,000 naira is put on you. You don't know what's happening. So this happens in medicine also. You suddenly get a disease, you don't know what's happening to you, and you see that you or your loved one is suddenly not doing very well at all, and then you bring that person up to critical care, because that is where you of course investigate first, try to find out what the diagnosis is, do necessary interventions and organ support, and then treat whatever is reversible.
Okay, incredible stuff. The last bit in my introduction to you was you have a certificate in medicine and law.
It's medicine and law, yeah.
So is that a subject on its own, or is there two different disciplines?
They're absolutely two different disciplines. But, especially with this, in this age, you have a lot of litigations going on. You need to know what to do right, both for the patient from the medicine point of view, and you have to do it also legally right. There is a lot of aspect to it. You have to know, again, what is right legally. So that's why there are certificate courses for doctors to learn the law, the medical legal aspect of it. That's a course that I have done in medicine and law that also puts you, it is for setting processes right. It helps you in your quality. It helps you to drive your, your medicine, your treatment in the right manner.
And more or less cover yourself, basically, from any.
If you do it the right way, you're covered.
Of course, covered. You're covered. Yeah. Okay, but how important would you say critical care is, especially when it comes to patients' overall care?
Well, since I am an intensivist, I'm a critical care doctor. I'll say it's the most important aspect of treatment. Even if you look at any hospital you go to, if the patient is coming to critical care, though the family, if I am the next of kin, I seriously would be scared if my relative is going to the ICU, because ICU is like a dreaded place. But if you ask a doctor, if he's sending his patient to the ICU, he relatively sleeps peacefully at night, because he knows there's someone to take care of the patient at night. He knows that the patient is being taken care of much better than how the patient would be taken care of at the wards. So critical care is very important from the aspect of the patient, in the sense that this patient is going to get the best of care in the ICU. It's important from a doctor's point of view, because that is a place where you're continuously monitored. You have doctors round the clock. You have you don't wait till a particular time in the day when you're given medicines or your investigations are done. It happens around the clock.
So when is it actually needed for patients? When do you think, is it as soon as something is diagnosed and then boom, 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 or you have to watch and see and...
Case-to-case basis, but most of the times, now when you look at the hospital where I come from, we have something called a tertiary referral center. So suppose you have fever and you go to a clinic, or you go to a pharmacy first. You think you have malaria. You go and you get your medicines. 2 days later, your fever is not subsiding. Then you decide to go to a clinic, and then your doctor prescribes you some additional medicines. He says he doesn't think it's malaria. He gives you some medicine. two more days you wait, and then your fever is not subsiding. Then you decide to go to a hospital, and then you go to a hospital, and then they say that some investigations show that your body is not taking it too well, and you will have to get admitted. Now, by the time it's already 4-5 days gone, and then you get admitted, but then you're not feeling well. Probably most of the times these patients deteriorate to the sense that they don't remember what's happening by the 6th or 7th day. And by that time, they decide, okay, now it's the time to get to a better center. And then they come to this tertiary centers or referral centers, as we call ourselves. So by the time the patient comes, he will have multi-organs involved. His kidneys may have some failure. His liver might have some failure. He might have respiratory distress. His consciousness would be decreased. Now, this patient naturally goes to the ICU. There are different sets of admission criteria that we have. Now, this patient comes to the ICU, we investigate. Now, we find, okay, this is wrong with him, and we try to correct this disease that he has, while we also give all this organ support. I mentioned multiple organs that might be affected. So that is what we do. That is the essence of critical care in a patient's life.
Incredible. So I'm just listening to it, and I was, when you said go to a pharmacy, then from a pharmacy you go to another doctor, give you something, it doesn't work. Some people go back to the doctor and say, what you gave is not working. And I don't know. I'm just following your own procedure, how you do things. But people think otherwise. Did that doctor give me the right drug and all that? Was there a mistake made? Anyway, but can critical care help with well-informed diagnosis as well as support optimal treatment planning?
Yeah, I mean, if you have a well-informed diagnosis earlier also, you go through the same process, because sometimes you have a diagnosis, but say if you have a malaria or a dengue fever, you have, for example, your platelets, something called platelets in your blood. This keeps dropping. Now, when you have a diagnosis, you get your treatment from home or from another hospital, and then you realize that this platelet is dropping quite a lot. Now, with this dropping quite a lot, you have bleeding tendency. Now, this needs to be monitored. You will probably need a bigger venous access so that you don't bleed. You can be given drugs. Investigations can also be done from this. All this happens in the ICU or a high dependency unit, which again the critical care team looks after. So so even if you have a well-informed diagnosis, you might at times need critical care. Again, varying sepsis, infections, oncological patients, cancers. You might need all these, critical care interventions.
So, someone like me, for instance, I always wish, when I go to, if I ever do go to hospital, hardly do I, but if I go to hospital, I just want to see a doctor who's got a magic wand and just say, okay, boom, and you're all right.
Exactly. Everyone wishes that. And people who come to the ICU also, I mean, they expect that the day they come, probably in a couple of hours or within the next day,
everything is okay.
Is everything okay? Is that fine?
It's like magic.
It's like magic. So I told I wish I had that magic pill. I could just pop it in and you're fine.
But that doesn't actually happen. Okay. Are there lifetime effects for critical care patients after leaving the hospital?
Yes, some people do have lifetime effects, but most of them are reversible. It takes time. Most commonly, if you are it happens if you are in the ICU for a long time. It's called critical care polyneuropathy, where you have weakness of your hands, legs, some sensation loss. It recovers over time with physiotherapy. Short term, you can have some ICU delirium, which is loss of your sense of space, time and person, and this can also be reversed once you get to your familiar surroundings. So nothing majorly that will stay on with you if you're in the ICU.
Okay, so I got another one for you. Now let's talk about the evolution of critical care How was critical care? How did it evolve over the years in healthcare? Because it must have started somehow.
Again, Jeannie, I like because you're popular, so I'd say take a cue from your musings as well, where you talked about the university.
Yes.
So the human body. I mean, we evolve over thousands of years, so we have been the same. The body's been the same. So when you take at basic sciences that we study, it is essentially the same. The anatomy of the body, the physiology, we might have some advances here and there, but it's essentially the same. But when it comes to treatment, a lot of things are today based on what we call evidence-based medicine. You need evidence for whatever treatment you give. So if you have a particular illness, you don't go by I've been treating this illness with, say, a tablet X for 10 years, so I'll give tablet X. No. You have a study which says that tablet Y is better than tablet X,
yes.
Which is why you'll start using tablet Y, because the evidence says so. So, critical care has evolved a lot. Now, even coming to ventilators, for example, ventilators were started during the time of polio, where you would actually give pressure from outside, compress the lung, and allow it to relax so that air goes in. Now, we have advanced so much that we put a tube in, and, you can ventilate inside, actually. So, there's a difference. The most advanced ventilators today actually sense your electrical stimulus in microvolts and then give you your breath. So the medicine has advanced, as well as the facilities, the technology has advanced.
Okay, we're going to take a quick break, and when we come back, we'll continue with more questions for you, sir. It's still Smooth Health right here at Smooth 90.1, brought to you by Evercare.
Health on the Drive.
So Lagos, if you didn't know, now you know.
Stay tuned. This is Smooth Health on the Drive.
The global observation that helps raise people's
Smooth
awareness.
Health is powered by Evercare Hospital, Lekki, transforming healthcare in Nigeria.
Okay, we're back on the grind. I still have with me Dr. Rony, who's been giving us all the tidbits that we need to know when it comes to critical care, and I'm sure some of you are taking notes. I know a lot of us don't like hospitals. We don't like to go there. I for one, I don't like hospitals.
Don't like ICUs too.
I don't like, no, none of those. But then again, sometimes things happen that you have to be there. Okay, now what are some of the challenges of critical care, especially in sub-Saharan Africa, Nigeria, for instance?
Okay, so I've been in Nigeria for a short time, and I know the sub-Saharan region. We know the difficulties we face. Generally, it's not just in critical care. Generally, we have a problem with the healthcare facilities and the healthcare availability that we have in this region. When it comes to critical care in particular, I'm not going to talk about which hospital I represent, but in general, what we lack is probably facilities. You don't have a single facility which can, suppose I have a leg problem, I go to an orthopedic center, and then I have a respiratory problem there. I can't, meet a respiratory physician in that hospital.
You have to go somewhere else.
You have to go somewhere else. So that is one major problem that we have around here. That's one. The second thing is drugs, as in medicines, the availability of that, the availability of high-tech equipment,
yes.
Infrastructure. All this is actually lacking in this
in
sub-Saharan.
Now the thing is, we also have situations where, there's been calls and calls and calls on the government to improve healthcare, and this is what they talk about in their budgets every year, but we still don't see it, right? if the government is not doing it, what about private companies and private entities? Is this something that they're looking at as well?
Yeah. So I'll speak about both. Now, when it comes to the government health budgets, I feel that any country you take in the developing world, the budget of the healthcare infrastructure is basically based on primary healthcare, where you have to cater to the rural areas, and the general hospitals will not be actually thinking about all the advanced things that you can do. It is to cater to the general public. So they will have their basic infrastructure improving, while the advanced will take time, because it's the basic that they want to do for everyone. You don't want someone dying of a simple fever, but complex diseases are rare compared to the other diseases that you see. So that's with the government setup. Private players, I can talk about which company I represent. We have taken, I think, the healthcare platform here, not a couple of notches, more than that, higher. We have all these facilities that we talked about, which is actually lacking in this region. I can talk about critical care for sure. We do have all these facilities. Even if you talk about advanced ventilatory features that we discussed, we have all of them in our unit. We can do any of them. So if you have an advanced respiratory problem, you can't breathe, our unit, I think, is probably the best unit, not just in the country but in the region, which can actually cater to that problem, and any advanced respiratory support can be given. I think the same goes with every other disease. So yes, private players, I'm not actually authorized to speak about other private players, because I'm not sure what they are planning to bring in, but we have this on the ground already running.
And that is it's critical indeed that at least someone comes to the fore and says, you know what, let's take the bull by the horn and start to do what we believe we can do to improve, the healthcare facilities and healthcare of the populace of the country. In what way is Evercare supporting and changing the dynamics of critical care in Nigeria? What way?
Yeah. So as I told you now, evident from the last few months that we have been functioning is that we've got references coming from all over the state, all over the country. We've got even referral requests from outside the country. That is how we have developed. We have a fully functional, if we talk about the ICU, it's a 22-bedded critical care unit. We believe it's the largest single critical care unit in the country. We have, each bed is having a multi-parameter monitor. You have ventilators, you have all these syringe pumps, infusion pumps that you see. So because everything is monitored, our records are all electronic, so you don't have papers at all. So everything is recorded automatically. We have 4 isolation rooms, which means if you have a disease that you don't want someone else to catch, you put them in the isolation room and you treat them there. You have someone who is immunocompromised, who should not get an infection. Again, you can put them in the isolation room. So we have 4 rooms like that, and 18 beds, 9+9 outside. We have dialysis being done inside the ICU. Again, I don't think any other center does that. We have dialysis and something called continuous renal replacement therapy, which is a slow form of dialysis. So if your patient is very sick and his BP is very low, we can do something called CRRT. So there are a lot of firsts in the unit that we are doing in the country, of course.
And I'm sure that you have, various facilities in place for critical care and intensive care unit of Evercare Hospital.
Yeah, we have actually in our building at Lekki, we've got 2. A medical ICU, a surgical ICU. We have got a high dependency unit. We also have a pediatric intensive care unit and the neonatology unit, which is being taken care of by the pediatricians. We do have certain recovery rooms for post-operative patients. They are located where the operation theaters are. All these are monitored full time.
Okay. Now, please share with us some of the critical care situations that you have encountered during your time, right? And the treatment options that you had to resolve in these cases.
Yeah, I'll talk about a couple of cases that we have had very recently. One was a young lady who came in with paracetamol poisoning, and she took a lot of paracetamol, and it was a very high dose. Ideally, in these cases, you would want to refer these patients to a liver transplant unit, which is not available in the country. We wanted to medvac her, and we did eventually medevacuate her to UK, to King's College in London, which is probably world famous for liver transplants. I'll tell you the final part. When she reached UK, she didn't have to stay in the ICU. She could go out of the ICU. That's the treatment that we did here. Yeah. We treated her for almost a week to 10 days before she could fly. Her liver had started to fail when she reached us. We gave her supportive medication, supportive drugs. We had also some differences with the UK team who was coordinating with us, but we said we will do it our way. There were some deficiencies. We couldn't source certain drugs, but we used alternatives, treated her, she got better, she went out. That's one. I have another case right now in our unit. She was referred from another facility. She was in that facility for 50 days, referred to a facility because they could not take her off the ventilator. And touch wood, for the last 4 days, she is not on the ventilator. She's been off ventilator. She's talking and she's doing fine. Hopefully in the next week, we'll move her to the ward and then she can go home.
Okay, that's fantastic. We always want to hear good news when it comes to medical challenges. But which other specialists attend to critical care, and what is the approach to treatment at Evercare Hospital?
Thank you, Jeannie. I almost forgot to tell or mention about my lovely colleagues at Evercare.
Yes.
At Evercare, actually, so ICUs run in two ways around the globe. It can be either a closed unit or an open unit. A closed unit is where only the intensivist manage this patient. An open unit is where anyone comes and puts their patient, and the intensivist could just do rounds in a day. What in Evercare, we have a blend of this. It's called a semi-open or a semi-closed unit, where the patients, now a clinician can put a patient in the ICU. We take over the patient, and this clinician, along with other relevant specialties, come and see this patient on a day basis. We have multidisciplinary team meetings every day. We talk about the patient, have a conclusion, consensus on how to go ahead with the patient, make a plan. We have counseling rooms in the hospital. In our flow, we sit with the family in the counseling room, talk with them, give them the plan, and then update them on a day-to-day basis. So it's a multidisciplinary team approach that we have at Evercare. Though the ICU, the intensivists are there, all our colleagues there take part in the care of the patient.
Care of patients, which is just absolutely fantastic. Now, Doctor, can our listeners contact Evercare? How those who want to, some people have been taking notes and say, okay, how do I get in contact with Evercare Hospital?
Yeah, absolutely. So the easiest way is to pick your phone and dial a number. Our number is 0813 985 0710. That's the phone number. If you want to visit our website, it's www.evercare.ng. If you want to mail us on any queries you have, it's info at evercare.ng again. If you want to visit us directly, we are at Admiralty Way. We are one at Admiralty Way, Lekki Peninsula Scheme, Lagos.
Wow. So that is it. We've had a very handsome Dr. Paul Rony in the house, very clued up about what he knows. And I mean, if you were with me at the beginning of the show and you listened to the kind of intro that I gave, you'd have thought it was royalty that's coming into the station. Royalty comes to the station because all the strings to his bow had so many. And if you put some arrows on them and you fire them, they'll go in all different directions and must hit one apple or two in the process. Anyway, Dr. Paul Rony, thank you for coming on to the show. We do appreciate all the insight that you've given us, and a lot of our listeners too will take we'll take note of all of that, and we hope to have you here sometime again. And I'd just like to reiterate, if you want to go to them in person, it's at number 1 Admiralty Way / Bisola Drosimi Eti Drive, Lekki Peninsula Scheme 1. Website, of course, is www.evercare.ng, EVERCARE, and telephone is 0813-985-0710. Email, of course, info@evercare.ng. And that's how we come to the end of Smooth Health, brought to you by Evercare. Thanks again, Doctor, for coming on the show.
Thank you, Gene.
All right, then, Smooth Drive continues after this.
Smooth Health on the Drive.
It's a global observation that helps raise people's awareness of
Health information and tips for optimal well-being.
how to prevent it, detect, or treat it.
Every Thursday at 5:15 p.m.
So Lagos, if you didn't know, now you know.